Have you found yourself answering questions regarding first and best action? Very confusing. In this video, I'm going to use 10 questions, give you strategy, key concept on how to use common sense strategy in prioritization regarding this particular question, first and best action. You will never get it wrong. Let's get to it. First of all, this is the strategy to answer questions regarding first action. The first action is an immediate step the nurse must take right now to prevent harm or start the process. We want to prevent any complication to the patient. The first thing we can do, while the best action is not, it's just the most effective, what is going to solve the whole problem. Safest overall steps for the long-term improvement of the individual. This is the key. This is what you have to tell yourself. Am I solving an emergency problem or providing overall health to the patient? So what do you look for? Is the patient unstable? That means it has to be a first action. So you intervene immediately. You go through your ABC. If the patient is stable, it can still be first action by you doing what? An assessment before you intervene. The second one is if it's a best action, they asking you for what? Assume an urgent need already has been handled. Patient is stable enough. You're looking for what will bring the greatest benefit to the patient or recovery. And this will help you master these two questions. You will never forget them. And you get them all right anytime that you see that question. Therefore, this is the first one. Think about it. A nurse walk into the room and find a client with tracheostomy coughing violently and the tracheostomy tube dislodged. Test taking strategy, common sense. The tube came out, tracheostomy. What is the next first action? What are you going to do? Do you call the rapid response? Listen to the patient breath sound? Attempt to reinsert the tracheostomy tube back or give them oxygen? As you can see, common sense tells you the airway is lost. I need to restore the airway. We have an emergency. Test taking strategy includes prioritization. Using this question, you can see the first action is to provide airway, not oxygen. Oxygen, which is number 4, will provide the best what? Action. Patient need oxygen. But if you don't have airway, you can provide oxygen. And since this is an emergency, first action has to be giving the patient tracheostomy. Next question. What is the next best action now to evaluate learning? The client with heart failure has been educated on what? Low sodium diet. Education on low sodium diet. How can you best action, not the first action? Ask the client to explain the purpose. Ask the client to keep a 3-day food diary. Review weight trend. Have clients list high sodium food. Once again, it's the best action overall, not the first action that we have an immediate situation or a stable patient that you want to do assessment. There's no more assessment here. It's asking you for the best. If it's the first, then you provide just a verbal understanding of what they've heard. So that is number 1. Ask the client to explain the purpose. It's the first action. But the overall, to know if they understand what you've taught them, objective evidence is what? What do you think? Ask the client to keep a 3-day food diary. This will provide a better understanding and the best action for them. What is the next first action? A client receiving blood transfusion developed chills, fever, and what? Back pain. Bad problem. This tells you we have an emergency. The first action is to what? Prevent damage to the patient, prevent any injury to the patient. Do you give them acetaminophen, notify the healthcare provider, send the blood back to the lab, or stop the transfusion? We have an emergency. I don't want any harm to the patient. Of course, the best action to treat them and let the doctor know, but the first action is to stop the poison. We got to stop the poison. That's to stop transfusion. Another question, what is the next best action to ensure adherence? That means best overall, not an emergency. It can be emergency, but it's an overall. A newly diagnosed hypertensive client is starting treatment. Do you provide a printed material as a best action? Collaborate to set lifestyle goal? Schedule weekly blood pressure? Review medication side effect. The first thing I would do is what? I will provide all the things I needed to do and then printed material so that they can read about it. But the best thing is I have to make sure they can take the medication, they can adhere to the treatment. Therefore, I need to know we got to set lifestyle goal. This is how we can achieve a better blood pressure. So collaborating to set a goal is much better. You can see the strategy, this prioritization question using these NCLEX practice questions and answers to understand how to take care of the first and best action on the NCLEX question for nursing school. A post-op client surgical dressing is saturated with fresh blood. We have an emergency. Blood. No hemorrhage. We want to stop hemorrhage. What is your first action? Do you talk to the doctor, apply direct pressure, reinforce dressing only, and check vitals? Of course, I don't need any more assessment. Patient is saturating, right? My first action is to stop the bleeding. I put my finger there. Notify the provider. Reinforcing the dressing, checking vitals is the best. So now you know the patient is in shock, right? But first thing you do is to apply direct pressure. I'm using these questions to show you common sense. You can be able to analyze them. When you see them, don't overthink it. The answer choice is in best and the first. And therefore, what do you do? Am I an emergency? Am I providing overall well-being to the patient or solving the problem? The client with type 1 diabetes is admitted with what? Food ulcer. Bad problem, right? What is the best action to promote healing? Not the first, but the best. Overall treatment, right? The first action is I will teach them about foot hygiene so that the condition doesn't worse, right? I'll teach them to avoid barefoot walking, but that does not overall. Overall is collaborating with the dietitian to optimal care, right? This will help in terms of preventing further problem and allow healing. We need nutrition to heal this problem. What is the next first action? Problem. First action. Once again, the client suddenly become unresponsive and pulseless. The client suddenly become unresponsive and pulseless on a telemetry unit. What is the next first action? I need to stop damage. Should I call the doctor, healthcare provider, retrieve crash cart, or begin chest compression, or check cardiac monitor? Think about it. Common sense. Patient has no pulse, is unresponsive. What would you do? The best thing to bring the patient back is not calling the doctor, which is the best action. That will give you orders to do. Retrieving the crash carts, yeah, that will bring you orders to do something. Or have medication to provide to the patient. Check the cardiac monitor, yeah. But patient is pulseless, unresponsive. You've done everything. You've seen everything. You should apply chest compression, first action. What is the next best action to promote independence? Alone, independence. They have a problem. You want them to have independence. What is the problem? A client recovering from what? Stroke has left-sided weakness. What is the overall? Think about it. I want the patient to be on his own, independence. Providing the client everything is the first thing. You have stroke, hey, I'll provide all ADLs. I will encourage bed rest. And I'll use UAP to assist mobility, all these things to help you to adjust to the new problem. But overall, is to provide occasional therapy. They will help the patient, complication associated with the condition. Then later on, the patient can start doing what he's supposed to do. What is the next first action? Now you get a strategy, right? Am I in an emergency situation? A client with suspected meningitis admitted. You may see this kind of question, especially infectious control. Patient has meningitis. Do you place the client on droplet precaution? Do you administer antibiotic? Do you obtain a blood culture? Do you perform neuro assessment? Look, I have meningitis. I'm in the emergency room. Wherever I am, my first action is to prevent everybody from getting infected. So isolation is the first thing you do. But the best thing you provide the patient need antibiotic, patient need blood culture, patient need neuro assessment. But in order to prevent further problem to the staff and yourself, patient need to be isolated. Therefore, place the patient in droplet precaution. And the last one, how many did you get? Simple, straightforward. trying to make it easy, using common sense. You're using this NCLEX practice question for nursing school and for the NCLEX to be able to master this nursing exams prep to help you master your NCLEX review. The client reports new onset chest pain while walking in the hallway. So he has chest pain. Client is not sitting comfortably and pain-free. He has no pain anymore. What do you think is the best action? Do you give them nitro? Do you call the doctor? Do you place them at bed rest or schedule ordered stress test? I got to find the problem. Why do they have chest pain? Of course, if they still have pain, I can treat them. That's first action. Give them nitro. And then call the doctor later. But place the client on bed rest because they have problem. But we want to know what is happening. They need a stress test to figure out why they have chest pain. This is the strategy to master this condition. Like I said, first action is always the immediate step the nurse must take. Know how to prevent harm or start the process. And you ask yourself, is the patient unstable? If you're unstable, I need to intervene right now. If the patient is stable and he asks me about first action, I need to assess first. But if they ask you best action, they're asking you for the most effective, safest overall step for the overall long-term process of the patient. Assume that all the emergency stuff has been done. And that's what you would do. Take care of yourself, and thank you for watching. I hope when you see a first and best action question on the NCLEX or nursing school, this is the way you approach it. NCLEX strategy, prioritization 101. Bye.